Hello, everyone. I'm Kath McIntyre and I'm from the Australian Telehealth Society. Thank you for joining us today. I'd first of all just like to acknowledge the traditional land that I am on today. That's the land of the Kaurna people of Adelaide Plains, and I pay my respects to elders past and present and extend that respect to all First Nations people joining us today. This is part of a series of interviews we're doing with people who have presented at the last SFT conference, just to catch up on what's happened since the conference and what they're doing in the future with their projects. So I am joined today by Sharon Gannon, who is also with the Australian Telehealth Society. Hi, Sharon.
Morning.
And Dr. Arlene Rowe, who is a postdoctoral research fellow at the Centre for Health Research at the University of Southern Queensland. Hello,
Good
Arlene.
morning.
Thank you for coming. And Dr. Frank Giolando. He's an adjunct lecturer at Monash University and CTO of Green Ant Networks. So, Sharon, I'm going to hand it over to you and I will just turn my camera off for a moment.
Thanks, Kath. So good morning, both of you. It's so lovely to meet with you. Unfortunately, I missed your presentation last year, but have been reading up on it since. First of all, before we get going, a little bit more about Green Ant Network. Could one of you just describe a little bit about that, and then we'll go in and talk about the presentation last year. Thanks.
Sure. Yeah, I can do that. So, yes, so Green Ant Networks is a Melbourne-based company that provides services to the health and research sectors. And in our capacity, we've been developing software together with University of Southern Queensland and Griffith University for the Momentum project, and that's really been the focus of the presentation that we gave last year. So yeah, the company basically provides a full set of web services that is based upon security and reliability for Australian medical and research purposes.
Fantastic. Thanks so much for that. Okay. So last year you gave a fabulous presentation, as I've been told many times by others. Can you tell us a little bit about that presentation, what you covered? And what I'm also interested in at the end of that is how you found SFT. Did you make any new connections as a result of attending? Like, what was there a bang for the buck for that as well? But first, about your research and the work you're doing. Thanks.
Yeah, sure. So, so essentially last year at the SFT 22, we presented the work that we'd done on the platform, which is called the Momentum platform, and what we covered there was really the as was fitting for the conference, the successes and challenges that come with developing a platform of the type that we did. So essentially, the Momentum platform is a content delivery platform for young people with mental illness, as well as a content creation platform. And that's all couched within a research quality data analysis framework. So it's quite a large project. It involves a lot of moving parts and has to also, be performant and scalable for large numbers of users that will be using the platform. So we looked at a lot of the aspects of how we built the platform, what components we used, how we managed to keep it as a modular platform, and then looked at the development process and how we work together with Arlene and her team to essentially work with their co-design process, which involved also working with young people, and also then to translate that into a sort of functional sort of design for the software development. Yeah.
And the conference, bang for the buck?
The conference was great, actually. So I know Alain was there, I was there, and Lauren Ferris, our CEO, was there as well. And we found it really, really informative, actually. It was from the perspective of seeing what's going on in the industry, it was really great. So there was a number of speakers that spoke about their sort of interactions with telehealth and other aspects of healthcare software and governance as well. Yeah, we found the discussions really interesting. I was part of a panel at the end of the session that I gave, which was really fantastic. And yeah, so that we found the conference really quite worthwhile.
That's fantastic. Eileen, can you talk a little bit about the co-design that you're involved in? I'm quite fascinated by co-design.
Absolutely. So a very large part of this project and I guess the primary driver for what we build and how we build with this platform has been driven by co-design processes. So from the very beginning, we met with children, adolescents, parents, and also service providers, including guidance counsellors, clinicians, various mental health workers, to really talk about what do they feel is missing within the space of these kind of online digital interventions at this point in time. What would they need to be able to work with it? What do the kids want to see? What's important to them? Those sorts of things. And we really worked with them in the beginning to even design the project from the start. And they've had their hands in the whole way through in this process, including down to the colors that we use on the platform, what images we use,
Yep.
what the activities look like, all of those sorts of things. So it's really been quite an important and quite a strong part of the entire process for us in building the platform.
That's fantastic. So where did you get the people that were involved in the co-design? How did you find them?
So various methods. Quite often we use sort of snowballing methods because we are mental health researchers, so we're linked in with quite a few different mental health services and different individuals working in the mental health workforce. So they helped us in our recruitment. But we also have a number of partner organisations on the project, including Kids Helpline, Child and Adolescent Mental Health Queensland, Queensland Education. So we Stride Kids. We've got a bunch of organisations who are actually part of this whole process, and so they've really helped us to find the right people to be able to help with testing.
No, that's a fantastic model, and it's so good because all those organisations are pulling together to get a system and a tool and a functional program that will really help all of the users. That's fantastic. Great, thank you.
Absolutely.
Okay, so what we want to know now from either of you is what's been happening since. Obviously, your work's continued and continuing. So what's the next steps? What's happening?
Eileen, is it okay if I take that to start off with, and then maybe I can hand over to you?
Absolutely. Yeah, sure.
Yeah, so from the technical aspect, we essentially in the last year we had a functional platform fairly early, and then what we've been doing is adding features, refining based upon the feedback from the co-design. And one of the unique things about the platform is that participants can really take their own path through the different information they're presented. And as I'm sure a lot of your technical audience will know, that presents some quite significant technical issues around making sure that that variable path following is consistent and reliable and also able to be tested. And so that's been a big part of the development process, has been not only developing the actual tools for doing that, but making sure that they're usable and easy to use for the universities that are building content. And that's been very much a back and forth process with Eileen and her team. And then also just refining, as Eileen was saying, around the appearance of the platform, the graphics that are used, making it visually appealing has been also quite a significant focus. So really just getting all those things, all those ducks in a row, as they say. But I might hand over to you on that.
Yeah, no worries. I mean, it's kind of similar. So obviously in line with working with Frank and his team to, I guess, help direct the technical components and sort of what we need to happen on from a technical perspective. A big part of our role over the last year has been the development and the integration of that program content and materials into the platform. So that involved the creation of images and videos, creating the session content and handouts and resources that the young person will be provided with their programs. And it also involved a lot of testing and from the user experience side of things. So we're talking about both the user in terms of the website functionality, but then also in terms of their experience in doing online assessments and receiving the results and carrying them through to a treatment program. And this has been a really important part of the process, and it's taken a lot of time to get it right, especially because, as Frank mentioned, each individual is provided with a tailored program based on their primary concerns that they report within the assessment. So we needed to really make sure that we get that right. And that's been a massive part of the work that we've done on our end over the last 12 months. I guess in addition to that, testing and refinement, we've also been looking at the integration of guardian or parent profiles into the platform and getting a parent portal set up. So this is a portal where parents can access the platform and view how their child's going with the program in terms of their mental health, and then access to their assessment reports and things. And the parent portal also provides resources and information and assists the parents in supporting their child. And provides them with information on different ways that they can access support for their child as well. So that's an important aspect of this platform as well.
So that raises for me a really interesting question about consent. So I'm assuming this platform is available to a whole wide range of young people. So is there a cutoff time for consent for parents or others to be looking at someone's information? How is that managed? And also, I'll just throw this in again. If something comes up that's a problem, is anyone from your organisation like monitoring what's going on for each individual person at a more specific level?
Absolutely. And these are really good questions and things that we had to really work through quite thoroughly before we could come to our conclusions on how the platform would work essentially in an open access situation where it is available to all Australian families. Excuse me. So in the first instance, for any child who's 15 years and under, they will require parent consent in order to sign up for the platform. And part of that consent process is that the child and the parent agree that in the instance where the child completes an assessment and it alerts that they are elevated in any of the clinical areas, that their parent will get a notice to just let them know about that, and information about resources and things that they can access to help support their child. So that's very much something that we tied within the platform. Right. Being an open access platform, and based on our experience with previous platforms that we have run extensively, we've got one that has over 76,000 users currently in Australia. We know that it's just not feasible, and it's not possible for us to be monitoring every single instance that someone enters something into the platform. So where possible within those assessments, we've done our best to highlight those triggers. We've also been especially careful about ensuring that there are very clear places for people to access support. So we have a massive help button that is available on every single page of every single view that the young person takes, so they can see that and access support through those supports. And we encourage them and deliver messages frequently throughout about them keeping in contact with a grown-up or a trusted person that can help them through the process.
Oh, that sounds really, really safe and fabulous. So that that button on each page, does that go to trigger a message to somebody else, or is it to actually give information to the user to say, hey, you might want to check in with parents or whoever? Is that what happens?
Yeah, exactly. So it gives them information and it gives them various supports within that. So they have the emergency sort of numbers and supports that they can access. Then they've got access to our partner organisations. So we link into Kids Helpline and all of those ones as well, that they can go there. Where we sort of came to with that is a lot of those organisations already have those very good processes in place to provide that support. And the purpose of this platform is not to provide that crisis support. So we really want to direct them to the places that do that really well. And so we sort of link them into all of those sorts of existing resources that are doing a great job in supporting young people.
Fantastic. And how do people hear about your fabulous Momentum? Is it? Have I got that right? Momentum. Yeah,
that's right. We are actually, so we're in the final processes of trying to sort of get the platform up and running. We've got some user testing and trialing of the platform with some live users to go. And if all of that works out as intended, then we will be looking at a wider dissemination of the platform, and we'll have a bunch of different advertising and promotional activities that we'll undertake with that. Primarily, one of our first steps will be going through our partner organisations. They've been a part of it all the way through, and we've tried to design this in a way that we can really help them with their service provision as well as helping the young people. So yeah, we'll be building from there and getting out in the community and trying to get the word out as much as we can.
Apart from this amazing work, are you guys working on anything else we want to know about? Do you want to share?
I think probably from my perspective, it doesn't end with the creation of this platform. You know, we've got some very big steps that come after that, including the, you know, running a number of trials to build the evidence base for the new platform. And that may include some refinements and working on it. Obviously, it's for lack of better words, it's a live document. You know, we will be continuing to grow and develop the platform and add different components into it. Currently, it's looking at anxiety and depression, sleep issues, substance use in young people, and healthy lifestyles. But there's plenty of opportunities for other things that we can extend into as well, you know. So we'll be looking at some of those things. And it's, I think really it's just the one project that is never ending.
Okay. And Frank, what about multicultural aspects? You know, for people, we've got people from every wonderful country on the world, in the world living here, and we want them to be here. What about different ethnicities or different cultural aspects? Is there any work being done in that area?
Yeah, so that's something that we've spoken about in the past regarding accessibility, and there's a number of different aspects to accessibility. One is simply having a platform that's easy to use. Then there's things like vision impairment and hearing impairment accessibility, and then obviously language groups is the next aspect of that. So that's something that we haven't tackled completely yet as far as having a fully translated platform, but it's something that we I think we'll be looking at in the future. So yeah, certainly one aspect that I think is really important of just accessibility in general, and there's a number of different sort of components to that, really.
Well, I think that's something that should be presented to SFT at a future date. That sounds very interesting. All right. Yeah. Anything else you'd like to tell us about your exciting work?
I guess I could mention a couple of the other projects that Greenant's working on. So we've got a couple of research platform-specific initiatives. One of them being a visual science platform, which is used for collecting data on experiments that to do with vision science, and that's one of the aspects we've been working on. And then we also have some other university partnerships that I unfortunately can't be very specific about. That's okay. Yeah, sort of in a similar sort of vein, looking at sort of patient sites where data can be collected in a sort of informative format, and really putting that all together in sort of data analysis platforms too is a big part of what we're looking at, because there's not a lot of point collecting all this data unless it can be analysed properly. So that's really a big focus of what we do. Well,
analysed and then used for all the greater good. Oh, that's exactly right. Okay, well, Kath, I haven't got any more questions. Do you have some for these amazing people?
No, but I just want to congratulate you on this amazing work and valuable work that you're doing. Like,
I'm blown away.
Yeah,
I'm blown away.
Absolutely. It's just absolutely amazing what you're doing, and well done. Congratulations. And if we can ever help spread the word, please let us know.